this is this idea of X39 and how does this technology work, okay? There was actually a study done, and these are the authors, Caitlin O'Connor, Melon Connor, David Yu, Janice Eickhoff, Susan Wagner, and Amy Chang. And it was published in Internal Medicine in 2021. This was the paper. It was a double-blind testing of the X39 patches to determine, could it raise this molecule called copper peptide. I will tell you, as a surgeon and as a physician, we have known about copper peptide for a long time. Copper peptide is a molecule that happens in the state of injury or trauma. And the reason it happens there, it causes stem cells to come to the area and then go throughout wherever they need to go throughout the body to heal areas of inflammation. There's these things called cytokines. It's almost like a homing beacon. And so if you have a problem in your knee, your neck, when I'm doing this to the face, that's where the cytokines are. And all the stem cells go to that person's face to help heal them. And this was statistically significant. I'll go through this a little bit here. Let's see if I can click here. So it's double-blinded. It was a controlled study, looked at the impact over 1 week and the level of copper peptide in the blood. And it was actually, this was fascinating. It was actually presented to the patent office to receive a patent for this technology. It was so unique. So there were 60 people randomized into 2 groups. They drew blood. They wore it for 7 days. They take more blood at 24 hours and for 7 days, and they saw a significant increase in the copper peptide compared to the group that did not use the patch. So let's just talk about what is copper peptide first. So we'll get back to the study here in a minute. So this was first isolated by Dr. Lauren Picard in 1973. It belongs to this group of emergency response molecules that released when we have injury and comes to a body's aid. And it's naturally sent to injured tissue and shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. And even in diabetics, this is fascinating, it improves axon survival and helps diabetics with diabetic neuropathy. It activates skin stem cells. I'm showing you in my case, it accelerates the speed of wound healing. It's beneficial for hair, skin, nails. It can tighten loose skin. It can repair a protective body, skin barrier proteins. I'm going to show you some photos here in a little bit. Reduce the depths of wrinkles, smooth, rough skin. It's antioxidant. Don't we all need antioxidants, right? And anti-inflammatory. We're understanding right now how bad inflammation is for our bodies. So here is something that if we can increase copper peptide in our body, we're going to have more antioxidants and less inflammation in the body. How amazing is that? Okay. It's altered by the expression of human genes neural function. So this is really saying that there's a whole series of genes that sort of set up neuron function. And they're showing that when you increase copper peptide, we can increase the gene expression by 50% to help neuron function. This is really interesting. It induces strong anti-anxiety, anti-aggression, anti-pain, sometimes minutes after in the study of rats. And I will tell you with my patients, we've had patients who we've put on this a month before, and they come and they say, you know, I just put this on and I just have a calming effect of myself. And that's because it's instantly affecting the brain to a certain degree. That's why we're seeing that. And this is something we never want to have, this thing called intracerebral hemorrhage. This is if you had a bleeding in the brain, what happens is the neurons actually die, do something called apoptosis. That means kind of the death of neuron cells. And if you have high levels of copper peptide, you actually have less damage of the nerves, less of that apoptosis or neuron death, even in the case of intracerebral hemorrhage. It's been implicated in resetting, this is amazing, almost 4,200 genes to a younger, healthier state. Just think about that. If you could reset your genes to a younger state just by let's not even talk about when I'm talking about X39, we're just talking about copper peptide first. If somehow we could increase copper peptide, and then reset 4,200 genes. And it's the #1 bioactive compound actually in the treatment of lung disease, chronic obstructive pulmonary disease. Amazing. They're actually already using this in therapy. And this is interesting. So when we have cancer cells, okay, we might have a cell in the middle and there's a cell in front of me, to the right of me, left of me, above me, below me. And normally there are signals from the surrounding cells saying, okay, I'm in the middle, don't divide anymore. What happens in cancer cells is that that cancer cell says, you know what, I'm not going to respect any of those guys around me. I'm going to keep multiplying. And it is that multiplication that becomes the problem, because they'll move into areas where they don't belong, and then they hurt the normal tissue there. The cells themselves are not always dangerous themselves. It's just where they go into that causes the problems. And so they found that if you can increase copper peptide, you can actually reprogram them to say, okay, instead of replicating, now it's time not to replicate or to die. Okay, we can't make medical claims about this. This is something that we're just seeing in the research. And we're just saying this specifically about copper peptide, okay? And we have never seen any side effects with this, the use of this. We've had people sometimes say that, oh, I have a little headache after. Sometimes we feel that it's actually pushing out toxins to a certain degree. And we might say, okay, instead of wearing for 12 hours, just wear it for an hour at a time. But there's never been any real side effects with the use of these patches or with copper peptide. It's been used, this is fascinating, in humans in the treatment of damaged segments in the neck. They have actually, so we're using copper peptide in the patch just topically. They've actually injected it in and around into the skin around the damaged area of the nerve, and it helps those nerves to reattach to each other. This idea of okay, this is a complicated sentence, but enhanced activity of alginate hydrogels for human cord blood. Mesenchymal stem cell osteogenesis. So they were trying to get bones to regrow, and they put on a gel, okay, on the bone to see if it grow. And when they put more copper peptide, we saw better healing of those areas, and we see an increased healing of many tissues. I'm showing you already the skin, stomach, intestine lining, bone tissue. It is strongly attracts capillary cells. So the copper peptide might be out there and saying, okay, we want to heal this area. Come on over capillary cells, come over mast cells, come over macrophages. They'll come to the area of the copper peptide and start growing capillaries and infiltrating the area, trying to heal that area. We have a natural gene system for clearing out the cellular debris in our cells. It's called this ubiquitin protease system. And they found that, not even talking about X39 now, we're talking about copper peptide here, right? Copper peptide, when it's high, activates genes, a downstream activation of this ubiquitin protease system to clear out our cells. Isn't that something we could all use? When we inject cortisone into a wound, it actually suppresses regeneration of that area. But when there's high levels of copper peptide, it blocks that anti-regeneration effect. So you can have the benefits of cortisone without the negative parts of cortisone. And this is fascinating. So there are things that we know that cardiovascular disease is one of the top causes for mortality, okay, in our nation and really around the world. When we have high levels of fibrinogen, that's actually a top predictor for cardiovascular and heart disease. When you have high levels of copper peptide, okay, it actually reduces fibrinogen synthesis. How wonderful is that? And when people have heart failure, it can actually, high levels of copper peptide can increase myostatin gene expression 9-fold. Amazing. In PubMed, okay, you can all go here, look up GHK/CU peptide. There are 43, let's see, there's 13 pages of this. I'm trying to see, it's small here for me. But there, you can go there yourself and you can see, 124 papers on this specifically. And this is talking just about copper peptide. So we're going to back into this. So if we could find a way to increase copper peptide somehow, this would be amazing, because look at all the amazing effects that copper peptide has on our body. Okay, so you can go on to this site and you'll see all these papers and you can dive into them. It's very interesting. This was one that they actually showed. This was talking about that angiogenesis. Remember, it said that it was actually causing vessels to grow in. This is where it came from. The copper peptide lysosomes were put on a scald wound in mice, and they saw proliferation and angiogenesis on the effects of copper peptide, like I was describing. Let's see here. This was another one looking at, this is Lauren Picard, who wrote these initial papers and looking at the protective actions here. And here they talk about, so there's this NF-KB, which is this really bad molecule that has to do with cancer and with aging. And copper peptide will actually suppress that molecule, which is really powerful. So going back to the paper now we talk about how amazing copper peptide is. Okay, so let's see what the results were. So we saw a significant increase in copper peptide in the blood in the active group compared to the control group from day 2 to 7. It almost took a day or so for it to ramp up to see the statistical significance, but that's what we saw here. So when we put it on their skin, you know, our skin is meant to work with light, this whole idea of photobiomodulation. When UVB rays come in, I mentioned that makes the skin red, but will actually be involved in a step to help make vitamin D from the sunlight in our skin. So we can put it really anywhere on the body. It's going to work. The studies were done initially on the back of the neck or underneath the belly button or umbilicus. And this peptide is amazing. So this is what it's showing. It increases skin, it improves skin and hair. So this is not saying specifically that X39 does this, but copper peptide does this. Copper peptide will actually help with colon cancer and program cell death. And we're talking about that NFKB, which promotes skin cancer growth. It inhibits that, okay? COPD, it actually protects lung cells. Superoxide dismutase, so it's anti-inflammatory, just amazing. And nerve function increases that. We talked about increasing the gene effect, and we talked about the intracerebral hemorrhage as well, and then using it for the neck as well. And so it's amazing how this is working. And they got a patent for this in 2020. So it converts an older liver cells to a younger state. It helps with collagen repair, and it's sort of like fine-tuning our genes, resets our genes back to a younger state. It's applied anywhere in the body, and then there's nothing in the patch. It's actually nanoparticle crystals that take our own infrared energy and reflects it back on itself, that in a frequency that causes an upregulation of copper peptide that recruits stem cells to the area. They then go throughout the body wherever there's an area of inflammation or cytokine activity, and that's where it starts to heal. This was interesting. They actually did a study in Japan looking at people in a very, very dark space, and they found that humans actually glowed. We actually have light coming out of us. We can't see it all the time, but it's really there. So, you know, we are these souls in our body. We put out energy, right? And that's what's going on here. So the benefits, okay? Stem cells, we can elevate stem cells, okay? So there's an immediate effect that people have with antioxidants and decreased inflammation. That's why certain people might feel like a calming soon after they put it on. More energy that people can have, better sleep. People are remembering their dreams a little bit more. We're hearing that. Dramatic pain relief. I'm going to show you something here. So this is really interesting, this idea that can happen within minutes. I have a colleague of mine who's in Philadelphia. He's one of my first mentors in surgery, and we were talking on the phone, and we were talking about ways to heal patients faster from my procedure before I really understood about X39. We were talking about something called exosomes at the time. And so we actually sent him some patches because he said that he had a wrist problem and he was going to have carpal tunnel syndrome surgery. So I said, his name is Alan. I said, Alan, let me send these patches to you. This might help your wrist. Maybe you don't need surgery. We overnighted it to him. It took him until Wednesday to get it. And he first put the patch on Thursday. He didn't tell me at the time, but he was having serious problems with his back. He had a lot of pain. He had steroid injections in his back, trying to heal his back. And it wasn't working well. So on Thursday, when he woke up, he was texting his doctor, seeing if he could have more steroids injected in the back to heal that area. So he puts the patch on, and you can read it here. It says, you know, he's having a lot of pain here. He said an epidural that failed. He said the patch went around 7:15. It was about 3 hours later. He said he was jumping around the OR. He said the nurses noticed it. Everyone noticed it. He said his back felt 75% better. He says, I don't understand. He says, but I'm never taking this off. And I was like, what? So this was one of our, now we call them these kind of one patch wonders. So not everyone has it happen this way, but this blew my mind. This is a fellow physician who is saying this. Now, I will tell you, he actually told us he's no longer undergoing neurosurgery for his back because his back is doing so much better. Wow. Is that an amazing testimonial?
That's huge.
Wrinkle reduction. This is a woman, Maddie, and this was after about 2 years or so on the patch. Look how her skin's getting better. And this will help. If you need more help, I'm here for you guys. This helps as well. Sports performance, they're noticing that people recover better after. That's hair growth. This was fascinating. This was from a woman. She said her dad's hair grew after about 6 weeks of being on the patch, which is something we're seeing too. This interesting skin rejuvenation. This person, this on the right here, he actually fell through rafters or through a ceiling. He broke 6 ribs, punctured a lung. He expected recovery was 6 weeks. He was back at work in 3 weeks because the stem cells have amazing abilities. If we can increase that, it actually can heal skin. Same thing with this fingertip. And this woman actually had radiation treatment. Look how her skin repaired after with X39 and with these patches. Decreased pain and brain inflammation. This is really interesting. These were really complicated sort of slides, but there's sort of hypoactivity and hypoactivity and hyperactivity. We want sort of something in the middle, and that's what this is showing here. We can actually improve brain health with this. Scar removal. This is interesting. This is a patient who had open heart surgery. This was her scar at about a year later, and then after a month, look at how much collagen filled in the scar. Look how much better that is. There's another case like this. Look at the way you don't have to put it on the wound necessarily. It's going to find where it needs to go. Okay, but if people want to put it on an area, there's no problem that it's going to work no matter where we put it. And here, look how her foot actually healed quite well there. Wound healing. This is from a surgical scar. It was 2 weeks. This is inflammation around the sutures. The scar is still there, but you see how much flatter it is because it's anti-inflammatory. And then youth renewal. Okay, and this was okay, and this was actually okay. I'm going to stop there. So this is part of another talk that I gave, but I think so. Did you find this interesting? Let me know in the chat if you found this was interesting about the nonverbal communication. Did you learn something about the skin? The ideas about reset, how we communicate with our bodies, and now about X39. So we know copper peptide creates these amazing results. We know that X39 will increase copper peptide. Ergo, we can make the conclusion that wearing this patch should help these sort of things happen. And we're now seeing it in practice.